Okay, so now let's just take a look at sodium and the chart here, how it has risk factors, assessment, and nursing interventions. So this one's hyponatremia, and you have loss of sodium, loss of GI fluids, and use of diuretics are some causes. Gains of water or water intoxication, which we did talk about in class. And think of when we ingest large amounts of water, we're technically diluting the sodium in our body. So that is why it causes hyponatremia. You want to look at the assessment data, what's important. So anorexia, confusion, seizures, coma. We know it's a serum sodium below 135. And then things that the nurse does, including those that require orders, and then independent nursing orders. So we want to be able to pick out what's needed for what are orders that a doctor would give versus what are independent nursing orders. So if you look here, if able to eat, encourage foods and fluids high in sodium. So we don't necessarily need orders for that. And then we want to avoid giving large water supplements. We know that that's because it can dilute that sodium much more. And then if we look at hypernatremia, I just highlighted water deprivation because it's a big one. So that's like your dehydrated person or fluid volume deficit person can have hyponatremia. So think of the insensible, sensible water losses. And then here are your assessment data. And as you can see for both hypo and hyper, coma is a big thing. So those are the similarities. Thirst, tongue dry, swollen, and sticky. That's a huge one to know with hypernatremia. And that's going to be completely different than somebody in hyponatremia. So knowing that part. And then here are your interventions. So underlining things that that you could do. Some require orders, some don't. So just understanding, you need to know the things that require an order and the things that don't. So you want to be able to then compare, sorry, I'm going to stand up here, the two things so that you are able to compare and contrast the hypo and the hyper and find the biggest differences and then the things that are alike. That way, when you are asked in a test, you know, the patient is a farm worker and he was out in 110-degree weather and he was not consuming a lot of fluids, what can be the potential electrolyte imbalance in that? And we know that somebody out in the sun is going to be sweating. They're going to have an increased loss of insensible loss, such as sweat, that can cause hypernatremia. So you want to see those things in that manner.